Hi, my name is Dr. Jennifer Lang, and I'm a gynecologist and GYN oncologist with offices in Glendale and in Century City. Bacterial vaginosis is the most common bacterial or fungal imbalance in women's body. So it's the most common cause of abnormal amounts of vaginal discharge for women. We think that it may be, in fact, as prevalent as about 30% of the average all-comer population will be found to have some level of bacterial vaginosis. It's not specifically considered a sexually transmitted disease. However, it is associated with sex, and we don't believe that it is found in women who have not had sexual encounters. So bacterial vaginosis is really an imbalance in the normal bacterial, what we call the flora in the vagina. So it's an overgrowth of some of these more abnormal strains of bacteria, particularly anaerobic bacteria, and an undergrowth of the normal healthy hydrogen peroxide producing lactobacilli, or the normal healthy bacteria in a woman's vagina. From an allopathic perspective, bacterial vaginosis is a common complaint that women come into the gynecologist's office with. And my approach is to use a holistic methodology first and really resort to prescription medications if those initial holistic changes are not helpful for the woman. So again, I think the immune system is essential, and a woman, in fact, becomes more susceptible to bacterial vaginosis when her immune system is being suppressed. So working on sleep quality, working on a healthy diet that is particularly free from added sugars and added sweeteners like high fructose corn syrup, also refined carbohydrate products, so white breads, pastas, those kinds of things can really make the bacterial imbalance more prominent. So I initially start by working with dietary modifications and immune boosting strategies. Most women will resolve a bacterial vaginosis infection spontaneously. But if they start doing some of these immune boosting strategies, usually we get results within days. There are some women who, for whatever reason, suffer from chronic BV infections. And those are women that I think it is perhaps most appropriate for them to consider working with a holistic practitioner to look at what may be going on in their lives or their bodies that is making this problem just continue to come back. I don't believe in the chronic use of prescription medications for these problems, and I think, in fact, that depending on which medication we're using, we can sometimes cause more problems than we help to heal. It's not uncommon at all for women to develop a yeast infection after being treated pharmacologically for BV. If a woman were to notice that she had an abnormal amount of vaginal discharge, maybe a certain odor that was uncharacteristic for her, she shouldn't worry. And then statistically, it is most likely to be a bacterial vaginosis infection. However, we have to consider the possibility that it could be another sexually transmitted infection. It could be yeast and not BV. So she should see a healthcare practitioner to have a correct diagnosis made. But in the meantime, before she can get there, I definitely recommend that she begin the process of supporting her own body's immune system by trying to decrease stress in her life. Stress is an immune suppressant, improve her sleep quality, and eat plenty of fruits and vegetables that are going to help her body's immune system to regulate the imbalance. She should also immediately cut out any added sugars in her diet and decrease or completely eliminate any refined carbohydrates.